So good news, endocrine system is rather short, so we probably will not be in class for super long tonight. Here we go. So when you look through the pathology textbook, the endocrine chapter is rather thin. It's rather thin. There isn't a whole lot in there. But we are going to cover the endocrine system tonight. I would like to usually start by doing kind of a quick review of the system itself, just to refresh our memory about the system that we're talking about and what the system does. That way we can start to better understand and our minds are in the right gear for us to start thinking about how these kinds of problems in the system will go on to create the symptoms of the pathologies that we're going to talk about later on tonight. So just a quick little recap of some of the major glands of the endocrine system. We'll recall the endocrine system is the system of glands and the hormones that they secrete and the litany of chain reactions that those will have in the body as those hormones are spread. The first we're going to look at is the thyroid gland. Do you guys remember where the thyroid gland is located in the body? Right there, right around your trachea. So it's a little kind of bow tie shaped structure. And the primary hormones that this guy creates are triiodothyronine, which is called T3, thyroxine, T4, and calcitonin. Calcitonin is used to help mineralize the bones. The parathyroid gland are just those four little bean-shaped structures. They are on the posterior side of the thyroid gland. The hormone that they release is called parathyroid hormone. Yes, that's the real name. I didn't make that up. The anterior pituitary gland. Anterior and posterior pituitary are like dead center in like the geographical center of the brain. They're located like right about there, but deep into the brain. And again, litany of hormones produced by these guys. Pituitary is called is often called the master gland because it's the one that secretes hormones that regulate a lot of other glands and hormones, but it is the hypothalamus that is in charge of the pituitary gland. Just a few that we'll talk about here. We've got human growth hormone. That's the one that makes you grow and develop. Your production of human growth hormone greatly drops off after about age 25 or so. Prolactin is the hormone that promotes lactation. So not milk production. Milk production is oxytocin. Lactation is the letdown of milk. That's prolactin. Thyroid stimulating hormone, the name pretty much tells you what's going on. It stimulates the thyroid to do its job. And whenever you see, so here's an example, adrenocorticotropic. Adrenocorticotropic. In medicine, when we talk about something, we use the word tropic, what we mean is changing. Like, so it's changing something. Think about the root of this word, like you think about the tropics, like in Florida, the tropics, because the weather rapidly changes. Having lived in Florida, I will tell you, it'll be sunny in the morning and then black sky, whiteout storm, and then beautiful sunset. And it's just weird. Welcome to the life. So adrenocorticotropic hormone, what that's telling you is it's a hormone that changes or has some kind of effect on the cortex of the adrenal gland. The name again is telling you precisely what it does. Posterior pituitary, we've got antidiuretic hormone that helps maintain water balance, and oxytocin, the love hormone. Now the hypothalamus is located up top, and that's the guy that controls the pituitary gland. So we've got the thyrotropin releasing hormone, corticotropin factor, and then the prolactin inhibiting factor. So as the pituitary starts the letdown of milk, the hypothalamus stops the letdown of milk. Thymus. Do you guys remember where the thymus is? Anybody remember where your thymus gland is located? It's a tough one, I'll grant you that. It is located immediately posterior to the manubrium of the sternum. So right in between the sternum and the heart. is where this guy sits. The thymus will deteriorate into adulthood, and it's almost entirely gone by the time you get into old age. But I'm gonna hit you with a hardcore flashback. You guys remember the immune system, the B cells and the T cells? The B and the T tells you where those white blood cells went to school. Where did they go to learn how to be a white blood cell? B cells matured in the bone marrow. T cells mature in the thymus. This is like white blood cell police academy. The thymus is an important site for immune cell maturation. It also releases several key hormones: thymosin, thymopoietin. Thymosin is the only one that we are really concerned with. And again, you guys, I do not need you to know all of these different hormones. This is just a review. There will be another slide that tells you the hormones that you need to know. So just take a breath. The adrenal glands are worn on top of each kidney like one of those little Devo hats. The adrenal cortex and the adrenal medulla will secrete separate hormones. So here's another one that I want to just mention. When we're talking about cortex and medulla, you see the pairing of these words a lot in anatomy. For example, in bones, you remember along the outside of the bone, you had the hard cortical bone, and then inside the shaft, you had the medullary cavity. That's where these words are coming from. The cortex is the outer covering. I don't like that one, sorry. Where's my undo button? Where's my undo button? Oh no. It took away my undo button. There. So if you think about something like an orange or something like that, right? You have your meaty portion of the fruit located inside, and then you've got the white like pith area covering on the outside. And you generally peel off the rind to get to the nice meaty portion on the inside. That is a cortex versus a medulla. So the medulla of the gland is the central core portion of the gland, and then the cortex is its outer covering. And with adrenal glands, the medulla and the cortex are both creating separate, they have their own lists of hormones that they're doing. They're doing their own things. So the adrenal cortex, the outer covering, is producing mineralocorticoids, glucocorticoids, androgens, estrogens. Meanwhile, the core portion, the medulla, is secreting epinephrine and norepinephrine. These are versions of adrenaline, one of which is active in the body, the other is active in the brain. Your kidneys, in addition to filtering the blood, also have endocrine functions. They're producing prostaglandins, erythropoietin, and chief importance, renin, the hormone renin. Its importance is water balance. Pancreas, the largest endocrine organ, it's producing insulin, glucagon, somatostatin. Insulin and glucagon are the two main important ones. Insulin lowers blood sugar, glucagon raises blood sugar. And so the two of these hormones are kept in balance in order to maintain your blood sugar cycles. The testes, male reproductive gland, we are looking at testosterone and androsterone. And I had to dig through my anatomy app to get a really cool screenshot of the testes. You had to like cut inside and open it up. It's really intricate in there, you guys. All those little tiny tubes, all those little, those are called convoluted tubules. That's their anatomical name. They couldn't have named it better. And ladies, I didn't forget you. Bam, cross section of an ovary producing estrogen and progesterone. Those little holes are like, I would imagine like little blood vessel type things because the ovary has just been cut in half and opened up. Fun stuff, good stuff. Okay, so hormones. Hormones are chemicals. At the end of the day, they are simply chemicals that are produced by the glands. They are generally going to be released into the bloodstream, where they will be carried to the rest of the body. And only specific cells in the body will have the correct receptor on their surface in order to bind and then be affected by the hormone. If you don't have the receptor on your membrane, then the hormone just passes by you and it doesn't make a difference to you. We generally recognize three classes of hormones based on how the hormones are synthesized. So the first we have are peptides. Peptide is a word you'll see a lot in anatomy. You'll also see the version polypeptide, but you probably know these by their street name, proteins. Proteins are chains of amino acids, right? That is what a peptide is. And that is exactly what a polypeptide is. It is a chain of amino acids. Voila. Welcome to anatomy. There's 5 names for everything. So peptides are chains of amino acids. Examples, human growth hormone and parathyroid hormone. The second category are the amines. These are derived from a specific amino acid, namely tyrosine. So tyrosine-based hormones. You're looking at things like adrenaline and thyroxine produced by the thyroid gland. The third category are steroids. Steroids are lipid-based, so they're created based on fats. And these guys can be made on demand. So you think about the kinds of hormones that you will always have a lot of in the body, like cortisol or testosterone. Kinds of hormones that you'll need great amounts available to you at all times. So the key hormones to know, wow, that's really small, sorry. Can we see that a little bit better? Nope. Is that better? Yeah, that's better. Key hormones to know, so adrenaline and epinephrine, same thing. These are made in the adrenal medulla, so the core of those adrenal glands on top of your kidneys. This is a short-term stress hormone. Cortisol is made in the cortex on the outer layer of the adrenal gland. It is your long-term stress hormone. This is the one that tends to be held in the bloodstream when you live a really stressful life and you don't know how to relax. Cortisol, in the short term, like when you are like actively in a fight or flight situation, right? You're being chased by a bear. So as your stress system kicks in, adrenaline and cortisol start flowing through the bloodstream. The function of cortisol is to act as an anti-inflammatory. So if you're thinking about it, if I'm running away from a bear and I sprain my ankle, you're not going to feel the sprained ankle. It will not start to become inflamed. You won't know about it until after the fact, right? After you calm down. The idea is we want to defer the immune response because we're actively running away from a bear at the moment. The problem is, at some point, you get away from the bear and everything is supposed to calm down, right? The fight or flight response is the body's only trick to deal with stress. So it does not recognize the difference between being chased by a bear and simply being cut off in traffic, or just being annoyed, or being yelled at by your boss, or having an annoying kid. So the way the body reacts to stress is by releasing cortisol. In the short term, it's not that big of a deal. In the long term, its anti-inflammatory effect begins to have a pro-inflammatory effect. It starts to promote inflammatory disorders. The second function is to depress the immune system. Again, I can't afford to have an allergy attack while I'm running away from a bear. The third is that in the long term, it can be destructive to connective tissues. So it can lead to things like thin skin and thin bones. Bone is classified as a connective tissue. Good stuff? Good stuff. All right, insulin and glucagon. These are the domain of the pancreas. Insulin raises the blood sugar. Insulin decreases the blood sugar. Insulin decreases the blood sugar. Glucagon increases it. Thyroxine is in the thyroid gland. Thyroxine helps cells convert fuel into energy, stimulating metabolism. This is why thyroid disorders often end up with people like having no appetite and they get super skinny, or it messes with their appetite and they start to gain weight. Thyroid gland, it's got its hands on the knobs of your immune system. And growth hormone. Growth hormone is released from the pituitary gland. It's critical to healing injuries, creating new cells, and it's only released in certain stages of sleep. It is also only released in great amounts during childhood and adolescence. You still produce human growth hormone, but just to a greatly diminished degree into adulthood. All right, first disorder of the night, getting into it. Diabetes. You guys seen that commercial, right? With that old man, that's not just a Southern thing. When I was diagnosed with diabetes, that man is really funny. So diabetes is an issue of the pancreas. And generally what's going on is that the damage is caused by prolonged high blood sugar levels. That's the issue. The cause of the issue is either going to be due to abnormal insulin secretion, so the pancreas isn't secreting insulin like it's supposed to, or poor insulin effectiveness. So the pancreas is making insulin, the rest of the body just isn't getting the message. It's just not binding and synthesizing or metabolizing the insulin like it's supposed to. So there's a nice little diagram. Type 1 and type 2 diabetes. Type 1 is considered juvenile diabetes, usually because it's diagnosed in childhood. This is an insulin-dependent diabetes. These are the one where they have to prick their finger, or they have to wear an insulin pump attached to their body. They have to check their blood sugar, frequently throughout the day, and then inject themselves with insulin as needed in order to regulate their blood sugar. These are the people who may have to, carry like sweets or something like that in order to raise the blood sugar. Generally, it's an autoimmune disorder. So what's happening here is that the immune system is targeting the specific cells in the pancreas known as the islets of Langerhans. Islets. Islets of Langerhans. Islets like small islands. As the immune system attacks the islets of Langerhans, they are no longer able to perform their function, which is making insulin. So the body doesn't have insulin. So the body has no way of lowering its blood sugar. The second type, come on screen. The second type is type 2 or adult onset. It's called adult onset because usually we are seeing it diagnosed in adulthood, like in their 40s or 50s. However, more and more in the United States, we are seeing type 2 diabetes being diagnosed in adolescents and young adults. We're seeing more and more diagnoses coming in from the ages of 12 to 25. This is a non-insulin dependent. The issue here is your pancreas is secreting too little insulin because the body has become resistant to insulin. So like any kind of tolerance, right? It takes more and more insulin in order to achieve the same response. But eventually your pancreas becomes exhausted and it becomes unable to produce the amount that it's required. So the amount that it produces starts to drop off. Treatments for this involve, insulin replacement and things like that. I mean, they can give you synthetic insulin. The issue here, though, is it's a lifestyle disease. So it's usually related to BMI. It can be secondary, however, to a lot of other kinds of endocrine disorders. So that if there are other glandular issues, then type 2 diabetes can follow as a result of those. However, generally it can be reversed through diet and lifestyle change. All right, diabetic emergencies, these are seen more commonly in type 1 diabetes. Again, if their blood sugar drops, they can pass out. This could pose a danger if they're driving or, if they're performing a dangerous task. Another diabetic issue is a condition called ketoacidosis. So again, since they don't have insulin, the cells can't assimilate glucose. So instead of burning this sugar for fuel, they start to burn fats and proteins. The burning of fats and proteins produces a byproduct called ketones, and ketones are acidic. The body can't cope with that extra acidity. So as the blood becomes more acidic, they start to get irritable, they get confused, dizziness, seizures, they can pass out. So this would be a medical emergency. Ketoacidosis requires a trip to the emergency room, but it's treatable. They usually recover. It just takes a couple of days to recover from it, but it's usually treatable once you get them to the hospital. I would like to take a brief moment and just delineate this really quickly. So ketoacidosis is a diabetic complication. The cause of the ketoacidosis is the fact that the pancreas cannot produce insulin. This is not to be confused with ketosis, right? Without the acido in the middle. Ketosis is a metabolic, what's the word I'm looking for? Metabolic pathway, metabolic process, whereby because the body is not receiving carbohydrates, then the body begins breaking down proteins and fats for fuel. The difference here is with ketosis, you are deliberately starving the body of carbohydrates, and therefore you do not produce insulin because insulin is meant to control blood sugar. Carbohydrates break down into sugars. So if you're not eating sugar, you don't need to produce the insulin. That's the difference. So if you are in ketosis, this is usually a nutritional thing. If you are going into ketoacidosis, you need to go to a hospital. You are diabetic. This is a problem. Good stuff. I feel like that might have gotten away from me. Good stuff.
Good stuff.
Cool. If you are diabetic and you are considering the keto diet, I would proceed with physician supervision, because this is the kind of thing that can make keto diet and diabetes not go very well together. Another diabetic emergency is insulin shock. So this is the opposite, right? This is way too much insulin is released. Sometimes this can happen if you inject yourself with too much insulin by mistake. Sometimes this can be done on purpose by vengeful ex-wives. I'm kidding. Insulin shock, you inject too much insulin, it causes extreme low blood sugar. It will knock you out. Too much insulin can put you into a coma. It's very, very bad news. Irritability, hunger, confusion, dizziness, all the way to, like I said, unconsciousness. Give them juice, give them candy, give them something to raise the blood sugar. Extra bounty points if you've got a PB&J on hand. You want to give them like sugar to raise their blood sugar levels, but they need something more substantial than that, right? A little piece of hard candy will just give a small little rise in the blood sugar. What they need is like a meal, something that's substantial to eat that will raise the blood sugar. All right. Diabetes can lead to several complications. One of the more common is cardiovascular disease. So the waste products of the fat and the protein burning start to create plaque in the blood. The plaque in the blood starts to cake on the inside of the blood vessels, leading the blood vessels to become hardened. Now you have atherosclerosis. Very high risk of heart disease, heart attack, death, right? You don't want to go hardening blood vessels. Because of the atherosclerosis, now that the arteries are hardening, you reduce the blood flow to the extremities. That leads to edema. We also have, since there's poor circulation, we're more likely or more prone to ulcers and gangrene. This will lead to amputations if something goes gangrenous. Poor blood flow also leads to nerve conditions like neuropathies. This is why diabetics have to check their feet a lot. The lack of circulation starts to kill blood vessels and blood vessels. What am I talking about? Lack of circulation starts to kill nerves in the feet. So they lose sensitivity. They lose the ability to tell the difference between hot and cold. So they'll step on something and cut their foot, and they will be bleeding all over the house and won't even realize it until they actually see the blood on the floor. Diabetic clients, we have to be very careful for things like that, because again, you might be hurting them and they don't feel it. Also, another complication of reduced blood flow is white blood cells cannot get to areas on time, so their small injuries are easily infected. Kidney disease also leads from the atherosclerotic plaque. So the high blood sugar is a diuretic and it pushes kidney functions. But as you push extra blood through the kidneys, those blood vessels have become narrowed by the plaque. So the kidneys can't perform adequately. Now you have kidney disease. Impaired vision, again, poor blood flow. Eyes, super delicate, guys. Eyeballs need a lot of blood to do their job. And if you go hardening those blood vessels in the eyeball, you can't really be all that surprised when your vision starts to go. Cells will uptake glucose without the need for insulin, but this causes cellular destruction in the eyes. And peripheral neuropathy, I touched on this earlier. The lack of blood flow kills nerves. So the nerve damage from the high blood sugar, they get numbness, tingling, all the nerve sensations, the paresthesia, that staticky, like pins and needles feeling, like when your arm goes to sleep, that's paresthesia. Okay, massage considerations. Oof, red text, no bueno. Massage considerations, massage is fine unless there is compromised tissue, meaning if there's tissue that looks necrotic or it looks gross, like it's not something you're supposed to be touching, you should probably avoid the area. But other than that, you can massage people with diabetes. Evaluate them for circulatory issues. So if they already are showing cardiovascular diseases, atherosclerosis, things like that, they may not be able to handle circulatory massage. Again, if the pipes are hardened and not able to be flexible, you don't want to go increasing circulation through those pipes. Be very gentle with your client, give them lots of feedback, keep some snacks or some juice on hand. If they have numbness or tingling in an area, avoid the area. Avoid areas of paresthesia. And again, they can always use an extra set of eyes. When you're massaging them, look at their body, look at their back, look at the legs, the feet. If you notice any injury, make sure you point it out to them. Honestly, they may not know about it. So if they have an ulcer on the bottom of their foot or, you know, a weird thing on their back, they may not be able to see it. They may not feel it. Okay. Hypoglycemia. So hypoglycemia, the name, one of my favorite way, I love medical terminology. The name is telling you what's going on. Hypoglycemia is a below sugar blood condition. You have low blood sugar. That's what's going on. What happens when you have low blood sugar? Well, you ever get hangry? It's like that feeling when you get hangry, like you're irritable, you're hungry, you get these like mood swings. But it starts to get worse as the blood sugar continues to drop. So then brain function starts to decline. So you start to get confused, you start to sweat, you get a headache. Hypoglycemia can be caused by a lot of different things. It could be a hormone imbalance. It could be a stress reaction. You might have an infection. It could also be a side effect from fasting. So if you're, you know, if it's just been several hours since you've eaten, like several hours since you've eaten. For hypoglycemia, they should eat first before you give them a massage. You can give them a small snack or something like that, but once they've eaten, yeah, don't massage people when they're hangry. Let them get some food in them first. All right, getting into some fun stuff. Hyperthyroidism. Hyperthyroidism is an overproduction of one of the hormones produced by the thyroid. Generally, we're looking at T3 or T4 hormones. Again, thyroid has its hands on the knobs of your metabolism. So when we start to crank up the hormones, we start to increase the metabolism. So your heart rate goes up, You start to get nervous, anxious, jittery, increased activity. Your skin starts to become very thin. It keeps you awake, so you get insomnia. Most of the time, what's going on here is an autoimmune attack on the thyroid gland. But the way that we usually treat that usually leads to the opposite condition, which is hypothyroidism. So there's a really fun catch-22. One of the complications of hyperthyroidism is goiter, which is an enlarged thyroid. Now, all of us are probably too young to remember this, but way back in the early 1900s, there was a public health crisis epidemic of goiter in the United States. Goiter, when it swells up, it's like a baseball-sized lump on the front of your throat. And a lot of people were developing it. So the solution here is iodine. The body is lacking iodine. So by producing iodine or providing iodine in the diet, you're able to get rid of the goiter. So we started iodizing the salt. And that's why you see iodized salt. It's to prevent goiter. That was a public health response. And before you get all conspiracy theory nut on me, guys, it works, and iodine is harmless. Okay. But yeah, goiter, it's not fun. It's not fun. Exophthalmia. So there's fluid buildup like edema behind the eyeball, which starts to push the eyeballs anteriorly. And as your eyelids retract, it leads to this like bulging eye look. Now, we're not talking about those cool people on the internet videos that can like bulge their eyes on their own. This is not voluntary. This is not voluntary. So hyperthyroidism, massage is okay, especially since it will help calm them down. But you do want to avoid the thyroid area. I would just not go massaging over the gland. All right, so now the opposite condition, hypothyroidism. Etiology here is a low thyroid function. So again, now we think about turning down the knobs on our metabolism. We start to feel cold and we are intolerant to the cold, dry, cool skin. This can lead to menstrual irregularities, weight gain, constipation, depression, goiter, fatigue. So as things go down, right, you start to go down into the couch. Fatigue, constipation, weight gain. So lots of things could contribute to hypothyroidism. We have Hashimoto's disease. This is an autoimmune disorder. It could be caused by treatment for hyperthyroid conditions, right? So your problem is you've got too much thyroid hormone. So they give you drugs to lower your thyroid hormones. And now your problem is I have too low thyroid hormones. This could also be a congenital birth defect. So you could be born with congenital hypothyroidism. This would lead to an interesting condition called cretinism, where people were born and they would stay super, super tiny. So this is also where like the insult cretin comes from, because these are cretins who are afflicted with cretinism, but the medical name wasn't meant as an insult. It was just a descriptor of a condition. Yes, and dwarfism and cretinism are different things. Two cretins. Oh, where did that picture go? Two cretins, the female is 27, the man is 20. Thyroids, man. They will screw you up. And then idiopathic hypothyroidism. Idiopathic, we don't know what causes it. Usually onset is after some kind of stressful life event. But again, with idiopathic diseases, they just arise, and we don't always have all the details as to why. We just have to treat it. So how do you treat hypothyroidism? Well, the most logical thing is thyroid hormone replacement. So you give them meds that replicate the thyroid hormones. These could be synthetic, natural, or compounded by a pharmacist treatments. So synthetic treatments like drugs, natural treatments like herbs, Chinese medicine, you can go that route. Or you can go to a compounding pharmacist where they can like manufacture drugs on site. But the idea there is that you want to reignite the body's fire. Like the fires of the furnace have been dampened. So exercise, change your diet, stress reduction, stress management, like get moving, do stuff to reignite those fires. So for massage, hypothyroidism is fine, indicated. It'll help circulation, it'll help mood, it'll help sleep. All right, so next we're going to look at the adrenal disorders. And so I want to take a look at the adrenal functions. Adrenal glands are stimulated in response to stress. So that is the sympathetic nervous system. If you took me for anatomy, we'll remember sympathetic and parasympathetic systems. This was your Spider-Man stress response and Peter Parker, the fight or flight. Or, I'm sorry, the Peter Parker, the rest and digest. Parasympathetic is like turning you back into relaxation mode. Sympathetic system is preparing you for emergencies. Cortisol is released during stress. It helps break down carbohydrates, fats, and proteins. It keeps your blood sugar up in times of stress. It decreases inflammation in the short term, but we remember in the long term, it promotes inflammation. And it inhibits collagen production. The logic behind this is we free amino acids for energy. So we can start using those amino acids for protein for energy. They also produce aldosterone, which regulates sodium and potassium. That is used in regulating blood pressure, as well as androgens, sex hormones. The androgens that your adrenal glands produce are involved in the sympathetic and parasympathetic phases of, orgasm. So like the sympathetic stress response to the peak and then the parasympathetic relaxation response afterwards. So here's a little cross section, right? I was describing the gland as like an orange, right? So here's one little segment of the orange. You'll see along the outermost part, that's just a little bit of fat. We like to have energy located really close. So we got a little bit of fat right along the top. The yellowish core would be the cortex. That is the outer covering. And then the thin kind of maroon portion at the bottom, just that bottommost layer, that's the medulla. You also see a little vein and blood vessels running through it. So the medulla is the central portion. The cortex is the outer layer. And again, it's the same ones from the last slide. I just wanted to give you a picture since we're talking about cortexes and medullas and such. Anybody remember the name of that character? No? I don't either. I inherited this PowerPoint. I've been punching it up with my anatomy app today, but Kim Possible is, I guess, is the Kim Possible thing, but adrenaline. I hope somebody got it because I did not get it. Okay, so on the topic of adrenal gland disorders, first one we're going to talk about is Addison's disease. So Addison's disease is adrenal hypofunction. We are not producing enough. This is idiopathic atrophy of the cortex, so the outer layer. So, oh Lord. Glucocorticoids, mineralocorticoids, we're looking at androgens, estrogens. These are the kinds of hormones whose production is being impacted. Usually the cause is autoimmune, but it could be autoimmune. It could be because of neoplasm, translates to new growth. What we're talking about is a tumor. There's cancer. That's why the function is disrupted. You're growing a tumor. Or iatrogenic. Iatrogenic diseases are diseases whose cause is in some other medical treatment. So if you got surgery and then you got an infection, the cause of the infection is iatrogenic. It's because of a medical treatment. So Addison's disease being iatrogenic, maybe it onsets following the withdrawal of corticosteroid medication, something like that. Manifests during times of stress or trauma. Symptoms: hypotension, low blood pressure, hypoglycemia, decreased resistance to infection, decreased cardiac output, and pigmentation of the skin, generally on one side. You'll see pictures where people are holding up their hands and one hand is darker than the other, like several shades darker than the other. Now, again, one of the more extreme outcomes of this disease is called an Addisonian crisis. Addisonian crises, they start to have like sharp pain in the chest, tightness of the chest, difficulty breathing, abdominal pain. They may have low blood pressure and kind of get fainty. They need to go to the emergency room. It's a crisis for a reason. They need to go to the emergency room. Usually they recover, no big deal, but they do need to be taken to a hospital. So if your client has Addison's disease, it may help to consult their healthcare provider, or at least get a doctor's note, just so that you know the extent of their condition. If they have been treated with long-term corticosteroids, then this could lead to bone thinning. So you'll have osteoporosis on the table now to deal with. Corticosteroids tend to reduce the body's ability to absorb calcium, as well as increasing how fast bone is taken down. So it blocks the body's ability to absorb calcium, and it accelerates the activity of osteoclasts, which break down bone tissue and release the minerals into the blood. So the more corticosteroids that they take and the longer that they've been taking them, the greater their risk of developing osteoporosis. All right. Good stuff, guys? All right. Cushing syndrome. The etiology of Cushing syndrome is excessively high blood cortisol levels for a long period of time. So let's take a moment real quick. Excessively high blood cortisol levels. I've been saying kind of breadcrumbs earlier. Cortisol in the short term reduces inflammation. Cortisol in the long term promotes inflammation, right? So think about other things that stress does to the body, right? Stress shunts blood from the central abdominal organs out towards the skeletal muscles. So digestion is reduced, reproductive activity is reduced, right? Now think about it. If your digestive activity is reduced, then the food that you're eating isn't actually being digested and absorbed, it's being saved for later. And your digestive system only has one way of saving things for later. We convert it all into fat and we store it. So now, do we understand why stress in the long term leads to weight gain and things like that? Because as you're stressed out, you're shutting down the digestive system. So you don't get nutrients. We just convert everything into fat and stick it in the fridge for later. So weight gain. We also said that cortisol reduces collagen production. So collagen is like critical to every type of connective tissue, including bone, including fascia, including skin, right? So with these kinds of things in mind, now when we see the symptoms of Cushing's, right? A rounded moon face, there's fat deposits on the face and the neck, giving like a distinctive rounded face. A dorsal fat pad, you're looking at a pad of fat that sits right there. So they end up with this fatty hump on the upper part of their back. Truncal obesity. This is obesity in the trunk. It is a striking thing. We're not talking about full body obesity. They have a very large torso, but their arms and their legs are very thin. Because the weight gain happens so quickly, they develop stretch marks. And because collagen production is really bad, the stretch marks are severe. The distal extremities, like the legs, will start to waste away. The legs become really thin. The muscles start to atrophy. The skin of the limbs becomes very thin as well. Wounds heal very poorly. This leads to menstrual irregularities, hypertension, high blood sugar, possible diabetes. So diabetes mellitus could be secondary to Cushing's syndrome. So I understand that I've like given you guys a lot of images, right? Rounded face, dorsal fat pad. This is Cushing's. Notice how the fat is concentrated in the torso, but the arms and the legs are not affected. So this isn't just obesity, right? This isn't what we're looking at here. The face and the neck have large amounts of fat deposits, so they present with that distinctive, very rounded moon face. Also, the face is extremely red through the cheeks and through the nose. The skin bruises very easily. The abdomen is distended. The stretch marks are severe. The stretch marks are characteristically red. Wounds heal very poorly. They bruise super easily. Osteoporosis is common. Also notice the dorsal fat pad right at the base of her neck. So when we look at people who are overweight and they say, you know, I'm not fat, I have a glandular problem. Here is a crystallized example of somebody. Like, this kind of weight gain happens rather quickly. Some clear visual examples of the kinds of stretch marks in the abdominal side of things. I just screenshotted a Google image search here, guys. So I literally just Googled Cushing stretch marks or something like that. But you notice how not only are the stretch marks much wider than you're usually used to seeing, that's because the skin has become weakened, but they're super red. That's because the healing is taking a long time. And since collagen production is inhibited, it makes them look really bad. Okay, moving on. Oh, bonus picture, the dorsal fat pad. Again, dorsal fat pad, I was like, that sounds like a band name that doesn't really like tell me anything. I thought a picture would sum it up for you a lot better. So massage and here's a really good picture. Notice it's down at the bottom. Notice how the face, like almost from ear to ear, is just rounded, super, super rounded, like a little moon. Yep. So people with Cushing's, can they get massage? Yes. Use lighter pressure, be cautious. Think about the secondary kinds of disorders. They could have cardiovascular disorders. They may have diabetes. They could have immune system problems, depending on what's causing their Cushing's. They could have bone thinning. Lots of things to consider. Doesn't mean they can't do it. It just means we have a lot to consider. I have a lot of questions to ask, and based on their answers, we'll determine how we can proceed. Good stuff. All right, folks, that was the whole chapter. That was endocrine disorders, bro. I will say this. I do believe that your quizzes should be available now. Quiz 3. Those cover digestive from last week and endocrine from tonight. So those quizzes should open up tonight. You'll have all week. They're due by next class. So we'll get those quizzes done over the next week. And then the midterms, I was looking over the midterms, and midterms include nervous system pathology. Nervous system is what we're covering next week. So at least midterms won't be until after class next week. But the other thing that I will say is the midterms are 50 questions, I believe, and they cover all of the disorders that we've covered so far. And nervous system is, as always, nervous system is a little more intense than the others. So next week, we probably won't be in and out in 50 minutes. Sorry. But I tried, man. I looked through the textbook to dig it up, and that's just, this is endocrine system. Good talk. Any questions? Any questions over what we've talked about today?
No.
No. Solid response.
I guess I'm like a little bit curious about coming up with treatment plans for people who have some of these issues, right? And if you're, I guess just the difference between working on your own as, a private LMT versus like working in a clinic or something, and like maybe if you have experience in what that was like for you.
So I was fortunate to have several years of working in a spa. So I was able to get a lot of really good experience. I had lots of veteran massage therapists around me. And the first thing I'll say is when you get into the real world, it's not super intense, because if you do have a question, there's usually other massage therapists around that you can ask. So I never felt like I couldn't find answers if I needed them. But I'll also say, in the spa setting where I was, generally people were coming to relax. We did have like muscular issues for sure, but I wasn't really having to deal with a lot of really bizarre medical issues. I was in Florida, so most people were old, so the basic, aging things, osteoporosis, things like that. But like with, and I've treated people with Cushing's, but that individual didn't have osteoporosis or anything. The Cushing's was pretty early onset. So, there really wasn't any consideration for me to have to take. Like, yes, she had Cushing's, so I used lighter pressure, but I didn't, she didn't have any other severe complications that I had to take into account. Other things like blood pressure and cardiovascular issues, your coverage for that is just asking them, are you on medication? Have you taken your meds in the last 24 hours? And they tell me yes, and then we can proceed normally. So most of the weird issues that I had to deal with as a therapist really weren't related to weird pathologies or anything like that. Most of it was trying to explain to a pregnant woman why I cannot do a hot stone massage on her. I've had several clients, again, Florida, but I had several clients who I noticed a suspicious looking mole on their body and had to bring it to their attention and recommend that they go see a dermatologist for it. You guys have done skin or malignant melanoma? You know what I'm talking about? The ABCs of malignant melanoma. And you like go down the list: asymmetry, borders, color, diameter, elevation. I've had to tell 5 clients that you've got a weird looking mole, and I recommend you have a dermatologist look at it. And it's always like, it's so stressful to have to start that conversation with somebody. But of the 5 times that I went, 3 of them had already had a dermatologist look at it and it was fine. 1 of them had an appointment for a dermatologist to look at it, but hadn't gone yet. And the 5th one was the one that had no idea. So she, like, after 4 times, my 5th time was the one who was like, what? I have what? I should do what? And I just recommended they go see a dermatologist. That's it. That's all you can do. But yeah, things may have been differently if my career was more in like a chiropractic office, but I worked in spas. I did foot scrubs. You know what I mean? I did Swedish massage and hot stone and deep tissue for sure, but it's fun stuff. I'll say one more thing. It is very important for massage therapists to have an understanding of pathology and an understanding of which conditions are contraindicated for massage and which ones you have to adapt your treatment plan for. And yes. However, I will also say that as a massage therapist, most of the really crazy, intense, bad pathologies, they're not coming to a massage therapist to begin with. So you don't even see these kinds of problems. Like I've never seen some of the kinds of disease. Like I've never treated a client with Alzheimer's. I've never massaged a client with dementia. I've never massaged a client with Parkinson's. Now, I'm not saying that people don't do that. I'm just saying that my career was in spas, and in the spa environment, you're generally not treating patients with those kinds of conditions. So if it's intimidating, there are certainly areas where you can avoid having to deal with things like this. But if this is your thing and you are really getting into it, man, there are so many rehab places where they would love to get a massage therapist in to help do lymphatic drainage massage or dry brushing techniques on diabetic clients or amputees, or you know, relaxing massages on people with dementia and things of that nature. I mean, there are, once you get licensed, man, it's your show. You decide where you want to go. That's the coolest thing about this career, is you have so many options as a massage therapist as to like what ultimately you want to do. Because everyone says they want to be their own boss. Everyone says like, oh, I want to open my own thing. Everybody says that. Bro, have you like owned your own business before? Because I did the solo massage therapist thing and it fucking sucks. I mean, it's not for everybody. If you're an entrepreneurial kind of person and you like, you know, and you, fine. I psychologically could not handle the stress of being an entrepreneur. I could not handle like where's my next paycheck coming from, and like where am I going to get client, and just like all of it. And you had to do everything. I had to learn how to build a website. I had to learn how to be a marketer. I had to like be the janitor. I had to do all of it. And what that experience taught me was I enjoy being an employee. Yep. So there's a lot of opportunity, and there are more than enough clients to go around. And if you think there's not enough clients to go around, then learn how to massage horses and go massage horses. That's a true story. That's a real thing. And if you're getting really bougie, you can charge to massage like dogs and cats, but you got to be in like West Hollywood for that. But there's a market for it.
I actually worked at an animal rehab clinic in West LA. And
oh my God!
Acupuncture and massage and rehab on them.
On animals?
On, yeah, dogs and cats. And
of course, why would I? Of course, why would I think anything differently? Of course. Of course, my hamster needs acupuncture because it's just such a life. But true story, man. I think if you reread the book and go back to the PowerPoints, if you have an understanding of what's going on in class, I think you will do fine on the quiz. I don't think anybody will have a problem. But you got to know your stuff. Good stuff? All right.
Good stuff.
If that's all, you guys, it's been a pleasure.
Thank you.
Thanks, Dave.
Thanks, Dave. Bye, everybody.
Good one.